Hello everyone, I'm off ill today, so I apologise if I look like something out of a zombie movie at the moment, but I thought I'd take the opportunity to make a video on seizures. It's something we see a fair bit of in the surgery. This is a live video, so if you want to ask any questions, just go ahead. I'm going to do it for sort of 10 minutes or so before the kids come home from school. So seizures, what is a seizure? You know, I often get called out of hours with people asking me or saying that their dog has had a seizure. And a seizure is often taken to be a collapse, whereas actually a seizure has a very specific meaning. A seizure is actually an interruption of the normal cognitive functions of the brain. So essentially, the normal thought processing that's going on, so something has happened to it and that they're not processing information like they should be. That's as opposed to something like a collapse, which could be, I don't know, like a faint, syncopal episode as they call it, or perhaps a cardiac problem, something like that. There's been lots of reasons why a dog might collapse, but generally seizures are limited to cognitive problems. And I guess the most common cause, or the one that we always go to, is epilepsy. Epilepsy is, the common way of describing it would be like a storm of electrical activity starts to take over the brain. And I know it's reasonably common. We've got quite a few. Hello, Annette. We've got quite a few epileptics in the surgery, and there's a real sort of spectrum of how badly affected they are. So your classical seizure with an epileptic patient, what we call a grand mal seizure, is the full starting to, they have something called a prodromal period where they start to exhibit odd behavior. And that's essentially a part of the brain starts to fire off randomly. And that starts to then spread through the brain. And it often leads to what's called tonic-clonic seizure activity. So this sort of tensing up and then relaxing and kicking the legs. Generally, whilst this is happening, the dog or less commonly the cat is completely unconscious. They have no memory of what's going on at all. They have no sort of processing that's going on. But it can be extremely distressing. So people who are seeing it, it is distressing to see. So really, a grand mal seizure in an epileptic patient is more distressing for us, the owners or the vets, than it is actually for the animal. There is a period when they come round from the seizure where they're a little bit confused, but generally within sort of 5 or 10 minutes that they're back to normal again. Now that would be at the far end of the spectrum, and at the other end of the spectrum you have what's called petit mal seizure activity. Now that could just be something as minor as a facial tic, or perhaps a paw just clicking away, or it could even be something like almost like the people who have petit mal epilepsy often report absent seizures. So they'll be staring out the window, people will be talking to them, and then suddenly they're back in the room and they have no memory of what's gone on, and it may have been just a few seconds long. And absent seizures in people are pretty common. They're probably as common in animals, but we just don't recognize them as much. It's just essentially that the computer is blue screened and it just needs to sort of reboot again. So what should we do with animals that we suspect to have epilepsy? Well, the first thing to do is, if you think your dog is having an epileptic seizure, be aware that they're completely unconscious and they could be entirely unpredictable in their actions. So they will often bite, they will often lash out, not at anything, but just completely randomly. So the idea of putting your hands into their mouth or putting their tongue forward or anything like that, that's a definite no-no. You will end up in casualty doing that. The only thing I ever recommend with an animal that is seizuring is to try and drag them to a place of safety. So if they're at the top of the stairs or in the middle of the road, let's try and get them out of the way of that imminent danger, perhaps by dragging them by the hind legs, whatever it takes really. But be extremely cautious. Animals will often injure themselves. They'll thrash around, bang their head, they'll bite their tongue. You know, it can be quite distressing to see. And obviously, any sort of injuries that are sustained during the epileptic seizure might need to be treated. But you know, you've got to look out for yourself. It's not that they're particularly extra aggressive or anything like that. It's that, you know, they just don't know what's going on. So you've got this sort of grand mal type seizure. It happens usually by the time people are on the phone to me, it's actually starting to resolve. The animal's coming around from it. You know, 4 or 5 minutes is a pretty typical length for these things. In that case, you know, it's not a dire emergency. If they're back around normal and acting normally, it's worth keeping an eye on them. But it's not a desperate rush to the vets generally. Generally, excuse me, sorry, I'm like I say, not very well today. But it is worth a checkup, because quite often it's not entirely clear whether it is actually an epileptic seizure or whether there is a cardiac event that's caused it. So I'll always recommend, you know, look, okay, it's 2 a.m. Let's, you know, just keep an eye on them for the rest of the night, pop them in the next day. Let's do some bloods. We'll check their heart. We'll do some neurological tests. We'll check their urine, that sort of thing, really to rule out any other causes of the seizures. The difficulty with epilepsy is that it's really quite hard to diagnose. It's kind of one of these diagnoses that you're left with after you've eliminated everything else. So, you know, we need to eliminate sort of brain disease, organic brain disease, which we'll come on to in a moment, and all these sort of physiological problems before we're left with it's probably epilepsy. The only way really of diagnosing epilepsy is during the seizure, having an EEG, an electroencephalogram on the brain, and measuring this storm of electrical activity that's happening in the brain. So yeah, it can be pretty difficult to diagnose, and ultimately we end up treating animals based on their signs often, rather than actually getting an absolutely definitive diagnosis. It's worthwhile mentioning that epilepsy is generally a disease of younger animals. So generally sort of 2, 3, 4, that's when we'd expect to start seeing some epileptic activity. Epilepsy in older dogs is relatively uncommon, and actually what could be causing the seizures are things like brain growth, unfortunately. So generally it's really, really worthwhile, if an older dog has suddenly started to develop seizures, it's really worthwhile about being particularly careful, ruling out any kind of mass on the brain. We can generally do that with a full neurological exam, so looking for droopiness about the face, an inability to perhaps chew, blindness, pupils being different sizes, deafness, all the, you know, pain around the head. All these sort of things can be, you know, indicative of a problem in the brain. But ultimately, the only way of ruling it in or ruling it out is something like a CT scan or an MRI scan, which are invasive, expensive, etc., and not always an option. So if we've got a dog that's seizuring, what do we do to treat it? Well, we need to, you know, bear the old maxim in mind that, you know, first do no harm. And quite a lot of these treatments that we have for epilepsy, not that they're harmful, but they do have quite significant other effects. I don't really like to talk about side effects, because all medicines have lots of different effects. But, you know, for instance, if we use phenobarbital, that can produce quite profound sedation. So it's worthwhile considering, you know, what are the effects of these seizures versus what are the costs of using medication. And in general, I would say that if they're having one seizure which lasts less than 5 minutes once a month, then it's probably not worth medicating them at that point. It's probably just worthwhile kind of shaking your shoulder and say they've got this issue, but ultimately it's not harming them, as long as they don't physically injure themselves. So, you know, why would we use medication? If, however, they have what are called cluster seizures, so if they are seizuring and is kind of seizuring, getting better, seizuring, getting better, seizuring, getting better, every sort of 5-10 minutes, or they're seizuring for more than sort of 10-15 minutes at a time, then they can develop something called excitatory neurotoxicity. So essentially this storm of electrical activity can release an awful lot of neurotransmitters, which can cause damage within the brain. And those are cases that we really ought to be thinking about treating. So a lot of the stuff that we use is actually from donkeys years ago. We started, they're kind of cheap and quite effective. So, phenobarbital, potassium bromide, it's all stuff from the 1920s, 1950s. But we do have more modern things that we can use as well, levetiracetam, keppra, that sort of thing. So there's a whole gamut of medication that we can use, and not to forget CBD oil as well. I know I'll be told off if I don't remember that. But we can mix and match these medications, because quite often what works for one patient doesn't necessarily work very well for another patient. Or you can have two patients which have exactly the same presenting signs, same duration, same frequency of epileptic seizures, but one will need a bigger dose than the other. So there is a certain amount of sort of finessing these doses. One of the things it's important to bear in mind with these medications is that they're removed by the liver by an enzyme called cytochrome P450, especially phenobarbital. And what we often find is that as the disease progresses, the doses of medication that are required to control the seizures seems to go up and up and up. That's not because the epilepsy is necessarily getting worse. It's generally because the liver is getting better at metabolizing the drug, and so the effective overall drug level in the body is much lower. So we need higher levels of drug to actually produce the same effect. Going on to sort of prevention now of the seizures, they're really hard to prevent. The one thing that I would say is that regular medication obviously will help to prevent them, but people often ask me, if they are they're going into this prodromal phase, maybe they're getting that absent look, they're starting to circle, whatever it is that they start to do, and you get to know what it is before they have an epileptic seizure, which is why dogs which detect epilepsy in people work so well. But whatever it is, I put them in a quiet room, I turn the lights out, and hopefully that will stop the seizure from coming on. That's actually probably the worst thing that you can do, because the brain actually if you have an excited area of the brain, it actually inhibits areas around it. So if you imagine an area of the brain that's starting to go into seizure-like activity, it starts to develop this pacemaker tick, just going more and more and more. If we can excite the areas of the brain around it, then that can have sort of a negative effect on it and suppress that seizure. We talk about something called seizure threshold. It basically raises the bar over which it needs to get before it suddenly explodes into full seizure. So actually, if you see them starting to go into this prodromal phase, and probably one of the best things that you can do is get a ball, or feed them, get them out for a walk, turn the lights on, really sort of overstimulate the brain. That can help to just reduce the likelihood of them going into a full seizure. There are certain drugs as well which can increase the likelihood of the seizure, and perhaps the key one that I've seen increase the frequency of seizures is painkillers. So dogs which have epilepsy and then develop arthritis or something like that, and they go on to Metacam or Loxicam or any Rimadyl or any of these painkillers, that seems to increase the likelihood of them having these seizures. When is it an emergency? Well, if a dog has been seizuring for 45 minutes, it starts to risk brain damage. So if you count on 20 minutes to get to a vet's and sort yourself out and that sort of thing, I think if you are getting to a seizure and it's getting to 10 to 15 minutes long and no signs of it abating, then it's worthwhile. It's definitely worth ringing the vet as an emergency and getting them in. With dogs which are prone to that, and we know are prone to that, very occasionally we can use something like rectal diazepam to, again, reduce the risk of it. Generally, what we do with dogs when they come in who are like that, we anesthetize them to try and decrease that brain function. So there you go. I hope that was useful. It's a brief run through seizures. It's a massive topic, and there's lots to talk about with it. But essentially, the takeaways are, seizures are very definitely a brain thing. If your dog is seizuring for more than 10 minutes, it's worth calling us. They're generally not huge emergencies once they've come around from it, but it is well worth checking out. And especially in older dogs, it's worthwhile ruling out other things. So good to talk to you all, and well, I'll see you soon. Bye.